Hi, I'm Corey Stapleton. Just gonna do a little bit of an introduction. I've been working at a few different clinics. Actually, I've been doing pediatrics, a little bit of women's health, and a family practice clinic as well. The family practice clinic that I did this case study in is in Linden, Utah, and I'm gonna go ahead and do my case presentation real quick for you. So SL is a 14-year-old Caucasian male who comes to the clinic today with right hand pain. He's accompanied by his mom. They both seem to be reliable historians. His chief complaint, he just says, my right hand hurts. He's been complaining of pain in his right hand that started 2 days ago. After a baseball game, he's the pitcher, pitched the batter hit it right back at him and it hit him in the right hand. And he's been icing it and taking ibuprofen, and that's been helping. He does have a history of broken bones, which I'll go into a little bit later. And he explains that the pain's on the outside of the right hand and the back and front. It's been hurting for a couple days. He describes it as an achy, sharp pain, and aggravating factors would be movement and pressure. Alleviating factors would be ibuprofen and ice that he's tried. As far as past medical history, he does have a history of broken bones. Like I was saying, in the last 5 years, he's broken his right wrist twice, 2 toes, his index finger on the right hand, as well as bones in his left wrist. He doesn't have any surgical history or hospitalizations. As far as medication goes, he's just been taking the 400 milligrams of ibuprofen PO every 6 to 8 hours, PRN pain, the last 2 days. No other medications, though. He has no chemical history. He doesn't use alcohol, drugs, tobacco, or caffeine. And he is up to date on all his vaccines according to up-to-date, and he does go to the dentist annually. As far as allergies goes, he does not have any allergies to foods, drugs, season, or environment. Medical or family history, the mom and him both deny any known medical history or family history of musculoskeletal disorders. The patient is in 9th grade. So for social history, he's in 9th grade. He's doing well at school, and in the social aspect, he feels safe at home and at school. Like I said, he's on the baseball team, he's on a club team, and he feels like he has an active style with his friends and family, always moving around doing stuff. Review of systems. The patient denies unusual weight gain or loss. He doesn't have any fever or fatigue, he says. He doesn't have any, so we want to rule out any sort of clots with a break, especially respiratory, when it comes to fat emboli. But as far as cardiovascular goes, he denies any chest pain, fatigue, dizziness, or dependent or generalized edema. There's no shortness of breath, work of breathing, dyspnea, or wheezing that he is aware of. And he says that as far as neuromuscular goes, he feels like he has a good sense of touch. He hasn't felt any numbness or tingling, paresthesias. He denies restriction to range of motion of the limbs. But he does say that the range of motion of the right fifth finger is limited due to pain. And he reports pain over the right fifth metacarpal bone. The physical exam portion, so the vital signs were all normal. General appearance, he's doing well, no signs of distress or malnutrition. But he does flinch when moving his right hand, or it's bumped or anything like that. The thorax and lungs, so the thorax is symmetrical with no work of breathing, no use of accessory muscles. There are no adventitious breath sounds noted with auscultation in the front or anterior posteriorly. For the heart, there's no visible pulsations, no heaves, no lifts, bruits, thrills, S3, S4 sounds or murmurs, but S1 and S2 are there, and they do sound normal. Extremities. There are no deformities necessarily in the extremities. There's no coldness. The patient does have a decreased range of motion, like I said, on the right, fourth, and fifth phalanges due to pain. There is tenderness on the right upper extremity over the fourth and fifth metacarpal bones. He's most tender over the fifth metacarpal phalangeal joint, and he does have some edema in that area over the third through fifth right metacarpal bones. Capillary refill is within 2 seconds, distal pulses are 2+, and sensory system is intact as the patient's able to feel both dull and sharp sensations. For differential diagnoses, I would say non-displaced fracture of the neck of the fifth metacarpal bone on the right hand. It's the initial encounter for closed fracture. That's evidence on radiographic views, which I'll discuss. Pain in the right hand and osteogenesis imperfecta is evidenced by multiple bone breaks over the last 5 years. The leading diagnosis for this patient would be the non-displaced fracture of the neck of the fifth metacarpal bone on the right hand. As far as the plan goes for diagnostics, we go ahead and do an x-ray on the right hand, a 3 view, which we went ahead and did in the office actually, and it showed transverse fracture of the neck of the fifth metacarpal. No joint extension, there's minimal angulation, there's no significant displacement. The soft tissues do show some moderate swelling. We go ahead and monitor for signs of osteogenesis imperfecta, such as short stature, scoliosis, basilar skull deformities, blue sclerae, hearing loss, opalescent teeth that wear quickly, increased laxity of ligaments and skin, as well as easily bruised. According to Up to Date, as long as they don't have any of these signs, which he did not, we would not need to do any further evaluation at this time. Therapeutic plan would be to go ahead and put him in an ulnar gutter splint to immobilize the joint for 3 to 4 weeks. According to Up to Date, we don't need to, with a non-displaced fracture of the fifth metacarpal bone, we don't need to cast. So 3 to 4 weeks in the splint usually takes about 6 weeks to heal. So definitely no contact sports during that time. Icing like he's done for the first 24 to 48 hours, and as needed if it helps with pain. Ibuprofen 400 milligrams PO, Q4 to 6 hours PRN pain. Patient education. It's important to wear the splint continuously and to maintain at least 7 degrees flexion of the metacarpal phalangeal joints. That will help to avoid stiffening of the metacarpal phalangeal ligaments. Ice and ibuprofen will help to reduce inflammation and pain and will also help in the healing process. With ibuprofen, it's good to tell them to take it with food because sometimes it can upset the stomach. The follow-up plan, we'll go ahead and follow up in 4 weeks for radiographic evidence of healing and non-displacement. If there is any sort of displacement of that bone, of the metacarpal bone, we go ahead and refer to a hand surgeon to take care of that in a more specialized manner. But at this time, we just keep following up. We just re-x-ray in a few weeks just to make sure things are healing well. I chose this case because, well, honestly, I just needed a pediatric musculoskeletal, and I actually love trying to figure out x-rays. I love trying to, I like the whole process of trying to figure out where exactly it is, what x-ray to order, and then looking at it and sending it over to radiographic specialists to look at it and see if I'm right or wrong. And splinting is something I feel like I've actually gotten to do surprisingly a lot of, more than I thought at least. As far as the other requirements for this SOAP note, holistic approach in caring sciences. So when it comes to a patient like this, you do want to provide holistic care. So he's probably bummed out he can't play sports, so you just try to talk to him, give as much education as you can, talk about healing and the recovery process, and help him feel like things are going to turn back to normal. Talking to the mom, making sure things are going well at home, especially where he has a lot of bone breaks. I think that's something you could follow up on. Making sure they're sports related or something. You just want to avoid. You want to make sure things aren't getting broken at home for things like domestic violence or abuse or things like that. If it was suspected, anything like that. So you could do more of like a head to toe to actually look and see if there's any bruising under the clothes, because that's one of the most common areas or signs that you would see domestic violence or abuse. So that would be one of the creators of care from Gene Watson's caring process. And that we could also provide holistic approach. I think involving the parents too is a big deal, especially in pediatric patients. Really having a family feel when it comes to diagnosing and treating the patient, treating them like a unit, treating them like a family. And there you go. There is my patient. And I was going to say, with memorable, interesting, challenging, I just think that radiographic stuff is challenging. It's a whole new thing. I have a book on it that I've been trying to study and to better interpret radiographs. But okay, there's my patient presentation.